Billy Cleary, welcome to the Tokyo Living Podcast.
Hi, Sam. Thanks for having me.
Thanks very much for coming on. Before we get started, perhaps if you could just, for the sake of the listeners and viewers that might not know you, just provide a little bit of introduction about yourself, what brought you out to Japan, and what you've been doing professionally up until this point.
Absolutely. Right. So currently I'm a clinical director at TEL Counseling. I am a licensed marriage and family therapist. I did my studies in Chicago, and my wife and I lived there for about 6 years before coming back to Japan. I've been in Japan a little over 10 years now. So the first stint was 2006 to about 2012. And I was working for a church as a Christian missionary. And it was actually during that time that I stumbled upon the study and practice of counseling. A guy famous in the field by the name of Carl Rogers. I think the book I was reading was On Becoming a Person, and there was quite a few themes there that I was drawn to about desire to help people, look at overall wellness, look at the meaning of life, and jump into relationship with people and try to support them however I can. So that took me and my wife to the States, and that's where I got my degree in training and came back in 2018. So exactly 4 years now. I've been working as the clinical director at TEL. I can share more about TEL if you're interested, but I'll pause there for now.
Yeah. We've had Selena and Vicky on to talk about TEL, and so we know a little bit about what the amazing work that you guys do. What exactly does your role as clinical director involve?
Right. So I'm responsible for looking after our clinic. So that's all of our counselors and staff that essentially support our face-to-face or our teletherapy counseling that we provide. We also have a solid assessment team that does assessment for children who are either struggling in school or needing some support, some extra permissions. And we've got two offices, one in Tokyo, one in Okinawa, and we do quite a bit of teletherapy right now. So we've got about a little over 40 clinicians on our team, about 10 to 15 staff. And so we've grown quite a bit in the last 4 years, and doing everything we can to support the need of the international community. But I'd tell you, a lot of our families are interracial couples or families, and a lot of Japanese people we're supporting and working with as well.
Oh, fantastic. Well, as you know, over the last, or sort of the month in between World Suicide Prevention Day and World Mental Health Awareness Day, we've been running this series of episodes focusing on mental health. And we thought it'd be good timing to get you on as a representative of TEL with the Tokyo Tower Climb this weekend. I wanted to do an episode where I sort of focused on the advantages and the benefits of exercise in terms of optimizing mental health. But I thought it'd be good to get you on and talk about it in not only discussing the science and the mechanisms of exercise, but also some of the practicalities in terms of implementing it as part of a multimodal or multidisciplinary approach to these conditions, and also some of the challenges that you might encounter when you're using this with your patients. So I guess I might get started by just discussing some of the mechanisms behind exercise. Obviously, as a physiotherapist and a health practitioner, exercise is our main tool for helping people with everything, but that sort of extends to the mental health realm as well. I think everyone inherently knows, or most people have a feeling that exercise has a positive effect on mood and can be a positive, a beneficial intervention to include as part of management of mental health conditions. But I thought it'd be good to maybe educate people a little bit more on why that is, and some of the science behind it, and also just provide some practical advice for those who are maybe struggling with trying to implement exercise. In terms of mechanisms, I thought I'd try and get some of the real sciencey stuff out of the way first before we lose too many listeners and viewers. So start off talking about the HPA axis, and this includes the hypothalamus and the pituitary gland in the brain and the adrenal cortex. And the relationship between these structures allows for essentially a cascade of substances to be released from the system. The hypothalamus releases corticotropin-releasing hormone, which then stimulates the anterior pituitary gland to release adrenocorticotrophic hormone, which then stimulates the adrenal cortex to release cortisol. And once cortisol levels increased to a certain point, then it stimulates the hypothalamus to release the corticotropin-releasing hormone again. And this is sort of the normal function of this axis. What tends to happen, though, in states of prolonged stress is that that whole axis gets thrown out of whack. So you get excessive corticotropin-releasing hormone released, and that stimulates an excessive production of everything else. Can also lead to hypertrophy or increased size of the adrenal cortex. And by doing that, the cortisol receptors then become desensitized, so that the system doesn't work as well as it should. With exercise, that's hypothesized to resensitize those cortisol receptors, so that it brings that whole axis back into more of an optimal working order. And the HPA axis also has connections with the hippocampus and the limbic system in the brain, which has influence over mood and motivation, and also over the amygdala, which regulates the response to stress and fear. One of the other key factors is the release of brain-derived neurotrophic factor. So this is a protein shown to correlate with mood states, and when this is increased, it's shown to cause a decrease in depressive states. And this is shown to be increased in both chronically and acutely with exercise. And then we get an increase in things like serotonin and endorphin levels, which generally promote more of a positive mood. That's some of the more sciencey things. Perhaps if you want to sort of jump in and where do you sort of start if you're managing someone that is presenting with a mental health condition and you want to recommend including exercise as part of their management plan? How do you go about sort of explaining some of the benefits and how are you sort of approaching that?
Well, that's a great question. I think as we were corresponding about setting up this podcast, even, talking about that intersection between physical health and mental health and where people can get stuck and bogged down, right? And so, I always try to set realistic goals for my clients or with my clients. As I think the with is important there, that I'm not the one setting them, but I'm working with them to help set goals that are realistic and manageable, right? I mean, I think people are already coming in. You take depression, so they've got low self-esteem. They're hard on themselves. They don't have a very positive outlook. So I might even take exercise off the table altogether. You might try to find some other areas of resiliency, protective factors, things that are going well in their life to help give them some confidence. But then if you do add a routine or something into their life, you just kind of track it on a case-by-case basis and you build up from that. But you want to be careful not to set a hurdle that's too high for clients early on in treatment.
Yeah, for sure. Yeah, I think that finding an entry point is really key, and I think the goal setting side of it is really important, and just I think finding out what they've done in the past, exercise-wise, what they've enjoyed, what they've not enjoyed, and I think you're obviously a lot better at this sort of thing than someone like me. But really getting an idea of their personality and using that to sort of guide maybe what sort of exercise interventions would be most appropriate for that person.
Mm-hmm. Yeah, I think that's essential, right? You have to kind of look at their environment. You have to look at the way they're wired and set them up for something, again, that's going to be realistic for them within that particular framework or goal that you're aiming for. And again, you set the bar pretty low. You try to build up some successes, wins in the beginning. And then, naturally, I think people just take over from there, right? I mean, it's kind of helping people access things they have within versus trying to get them to acquire something that's outside of their scope or outside of their grasp. So
yeah. I think one of the other main advantages from a practical perspective is sort of things like improved sleep. So we know how important sleep is for most sort of health conditions and health factors, and we know that exercise can improve sleep quality. And I think it's there's a number of these factors, but breaking the loop on certain things. So, if someone is getting poor sleep, then they may not have the motivation to exercise. They may not have the energy to exercise. So if you just, again, find that entry point, get them doing something and get it to the point where it does start to improve their sleep quality, and then that can improve their energy, and then it starts to sort of cycle upward.
Mm-hmm. Right. I mean, I think sleep is the bedrock, right? It's the foundational piece for wellness. And if you don't have quality sleep, if you don't have good sleep, then it's going to be really hard to try to undo a negative habit, try to undo a negative thought pattern or process that you're stuck in. And, the rule of thumb I've gone by, or that I've heard, is, try to wake up at the same time every day, right? If you have a consistent time that you're waking up, that's going to force you into getting into bed at an appropriate time, and not waking up drained. But, just kind of going to sleep and then not having a timer or any kind of check on the time that you wake up is pretty crucial, pretty consequential, at least from my experience and what I've heard.
Yeah, for sure. The self-esteem one is a really important one as well. Different types of exercise, I guess, harness this in different ways. But let's say someone starts doing some strength training and just starts to feel a little bit stronger if they can lift some heavier weights, so they can perform different movements that they weren't able to before. I think that can be a really powerful tool in terms of changing people's mindset towards different aspects of their life that may be causing them psychological stress. Is that sort of something that you see?
Oh, absolutely. Yeah, I think, I kind of struggle with the term self-esteem of really defining it, but I guess if we're to look at it, maybe you break it into two categories of one, feeling connected in your relationships, right? And the second would be feeling a sense of purpose, maybe in your work or your current role or responsibility. So, I guess the first one, I focus on that quite a bit, right? So my kind of approach with clients is from what's called emotionally focused therapy. It's a model just like CBT or some of the other models that are out there. But this one looks at attachment, right? So the connection between you and people that you're bonded with or that you're close with, right? And this could even be in a workplace situation, right? How well do you feel like you're connecting or getting along with your coworkers, people at work, that's attached to the sense of purpose. But I think when people are struggling in their relationships, right, either in their romantic relationships and their friendships, I look at a lot of the international people who move abroad, leaving family behind to come to Japan. They live alone, right, trying to feel that sense of connection, working through language shock, culture shock of self-discovery, right? So that attachment that you feel with others and that sense of safety, that ability to bond and feel connected, if that's not in a good place, then I think it also causes people to struggle and their self-esteem is impacted. That's where, you can start seeing depressive symptoms come about. And then people kind of lack the resourcefulness just to, stay on top of their physical health as well, exercise and whatnot. And so, one thing I was hoping to get into a little bit, and maybe we'll get into this more later, but, what role does the gym play for people to be able to build relationships and connections so that there's some kind of, accountability, or there's some kind of motivation? This isn't just for me, but I'm connected with a group or, an individual that is kind of prompting me or keeping me attached to this exercise routine, or, kind of being on track for the physical health. What role does that community play in all of this? And that's probably your world that you're in, right, with your company and all that you're doing.
Yeah, I think it's massive. I mean, if you take a facility like ours, for example, we have different models. We have people that are working with trainers one-on-one. So there's still a strong aspect of community. There's probably more of that aspect of having someone guide you and sort of monitor you and hold you accountable for for your exercise habits and the things that are going to be beneficial for you. And then we have the group class environment where it's more of a sort of community, and there's more people involved in that whole sort of accountability process, but it's probably a little less focused and I'm trying to think of the word, but I guess it's a little more casual and you don't have that one-on-one relationship and accountability, but it's more of a sort of group environment. I'd be interested to hear your take on if you think there's certain individuals that benefit more from a group environment in terms of exercise and lifestyle interventions, and whether there's people that you think actually benefit from more of a solo. Actually, let's say it's someone that is always around other people and they find that environment is quite stressful, and it's good for them to just get out and go for a jog and be able to sort of clear their mind. And I know there's certain people that really they claim to do their best thinking when they're out jogging or out cycling by themselves, and they're just there alone, and their head is in a more open space, and they can think clearly. I think, like, personally, from what I've seen, it's probably the majority of people do function better in that group environment, just because there's more people there to motivate them, and I guess it's just a little more fun. But like I said, there are those people that do really well with going at it solo.
Right. I'm just thinking about this as you're sharing this, but there probably is a something you need to assess there when you're working with individuals. What is going to motivate them, and again, what is a bar that is approachable for them? So people might prefer just kind of the more individualized treatment, to not have to be around a bunch of people if they've got some kind of social anxiety, or it could be the other way around of having a personal trainer have this person judge me or look at me a certain way, that it's better to blend in with the group. And so, maybe that's part of the assessment phase of just seeing what is a good fit for each individual. And I could see it going either way, but yeah, maybe being a part of a group would allow for some of the social connection as well that people might be looking for, right? If you're feeling lonely, you're feeling disconnected, you just need some kind of routine to give you an opportunity to be around people and maybe make some connections. And that might be what people are after, or it's that kind of more quiet one-on-one individual training that you're specifically just working on yourself. So
yeah. In terms of exercise modality, I mean, I think one of the other benefits to exercise is literally just the distraction from the stressful parts of life. And there's obviously some exercises that or exercise modalities and sports that do that, to different degrees. I know for myself, when I'm, unfortunately, I work where I train, so it's where I do most of my training, I should say. So if I'm sort of out in the gym, whether it's lifting weights or doing some technique work, I'm always at work, and I'm logging all my training on my computer, but then I'm also getting emails at the same time, trying to ignore them where I can, but then my staff are around me, and I'm sort of evaluating at the same time, and there's all this stuff going on. Whereas even if I'm in this facility, but I'm doing combat training, especially if I'm sparring, that's sort of the time where I feel the freest, where I'm sort of distracted from everything else. And I mean, combat sports is sort of in a category where if you are distracted, there's a chance you're going to get hurt. So it's in your best interests not to be distracted by other things going on. And I often joke to people and say that the only time I don't feel like I'm in a fight is when I'm actually sparring with someone. Now, that's not to say that I get in a lot of arguments or anything at work, but and I guess fight is probably the wrong word there, but it's always a challenge. You're always problem solving, whether it's trying to solve the problem or the condition that the patient presents with, or solving business related problems or staff problems. There's always that sort of challenge and that slight struggle. Whereas when I'm in a combat environment, I'm not thinking about that. I'm in my zone, I'm flowing, and that's sort of what I feel most enjoyable. And so I think, for me, that's something I've found that's really beneficial. And even this morning, like I was having a rough morning, some stress going on, and then I go to do some jiu-jitsu practice and some sparring, and automatically feel 100 times better. So I'm lucky that I've found what works for me in that regard.
Right. Just to respond to that, I think that this concept of being able to distract yourself, right? I mean, let's be honest, life is stressful, work is stressful. So being able to have that space that you're removing your thoughts, right? You're removing your mind from that space, and then you're 100% focused on, I mean, the sparring jiu-jitsu is a great example, right? That you can't, you have no yo-yo, you don't have any flexibility to focus on anything else, right? You just have to be purely embedded in that environment. And so that completely takes you away from the stress. It takes you away from kind of looking at your phone or, thinking about those things that are going to remind you of that stress. And I think this kind of distraction, right? There's like a healthy distraction that we can engage in, and there's a really unhealthy distraction. And I was just reading a study recently that said, there were, the conclusion was 30 minutes less of social media per day dedicated towards exercise. People showed improved mood and mind 6 months beyond the study, right? And so, once you engage in taking those 30 minutes, dedicating it towards exercise, you're going to feel much better, even down the road. And they used an interesting kind of correlation of they also did it with people that they saw had reduced smoking for 6 months. And I thought, well, what's the connection there between getting on social media and smoking? And one is probably the addictive behavior, but the other is the need for distraction, right? And so when we're stressed or anxious, we go to the device, right? We go to that phone or social media to try to pull ourselves out. But I would probably say 90% of the time, that's an unhealthy distraction. Sure. It's more a response to a distressful thing in our life to pull us away from that rather than engaging in something that's more healthy for us. And so probably the running does that too. It allows you to process some of those negative thoughts, get that stuff out of your system and move on a bit. Whereas if you're just going to a device, the phone, and you're in there for 30 minutes, you put it down and then you still have the problem right there. You're not better regulated. You're not physically, emotionally in a better place. You're probably in a worse
position. Yeah, for sure. And I think that can extend to other things like alcohol and even other drug use at another level. You talk about that time that you spend on social media being potentially detrimental, and if you replace that with exercise, replacing with something positive. And but if someone goes to the gym or they participate in the class a couple of times a week, it might be times where they would previously be out drinking or doing other harmful things. Obviously, everything in moderation, but I think that can extend to a number of different levels.
Yeah, absolutely. And I think it's hard for people to get out of that, right? I mean, that's why people don't exercise. That's why they don't look after their health, is because they're stuck. They're caught in an addiction, whether it's a socially appropriate addiction or not, they're caught in something. And so, again, that's where I come back to that kind of relational component is, do you have someone that can help pull you out of that? And is it, joining the group at your club, or is it meeting with the trainer who's going to kind of hold you to that standard? Because going at it alone, right? I mean, and so addictive behavior is caught in this pattern of loneliness. And there was a revolutionary study that came out, I think around like 2010, maybe a little bit earlier, that talked about the antidote to addiction is connection. It's not sobriety, it's connection, right? And so I think that's something that we all need. And so, if anyone's listening to this, they're struggling with getting their physical health in order, I would say the key there is or even mental health, right? Their mental health, getting that in order as well. The key is connection. And so meeting with the counselor, meeting with the trainer, connecting yourself with a group of people, going after a common purpose, those are all worthwhile attempts, right, and might
Yeah.
help you. So
I'm not sure this sort of mechanism is relevant for everyone, but there's also all that thought that if you're doing something, it's probably if you're doing something more strenuous in terms of exercise and something where you're having to push yourself and push yourself past your limits and learning to tolerate discomfort, that can translate to other areas of life and learning to be able to better tolerate stress and discomfort in other areas of our lives, and that can be beneficial as well. Obviously, I think that it's important to reiterate that it's always appropriate to start off where you're at and not feel pressured into going into an exercise modality where you're really having to challenge yourself, because that's probably not appropriate for a lot of people, especially when they're just starting off getting involved in exercise. But I think that for me, doing what I do in martial arts, you are used to challenging yourself and pushing yourself, and I think that can carry through to other areas of life as well, and just build that resilience and a greater tolerance to stress in general.
Mm. Right, yeah, as you're talking about that kind of building up tolerant stress, I think it's really important to push people, to challenge people, right? But one of, I think, the fundamental pieces you have to have there is safety.
Yes.
Right, even in the counseling room, right, building that relationship, building trust, kind of making sure I get you, you get me. Those things are so crucial to one's journey and kind of success along that journey. And it is hard, right? I mean, we think we come to counseling, someone who's never been before might think that you go there just to talk all about your feelings. Well, no, you really get into the things that you're dealing with and you're struggling with, and I have couples. I work a lot with couples, but they come back and I said, "How you guys doing? How was the session last week?" And I do get these responses from time to time that say, it was really, really hard. I mean, it was really difficult for us, but we're trusting the process. We're still engaged, right? And let's keep going, right? So I think this kind of challenging people is really good, but again, there's even in kind of the physical realm of working out or doing something like jiu-jitsu, there's probably a lot of safety that you're building around that to ensure a proper build-up or a proper training regimen for ensuring people are getting through it in the healthiest way.
Yeah. And I think that something like a lot of people may have done, general sort of resistance training or cardiovascular modalities and things like that. But I think there is something to be said for learning a different sport or something like martial arts, where you're just sort of learning different strategies and different learning strategies, different ways of using your brain. And I think that that can all be beneficial as well. And that doesn't necessarily need to be involved in exercise. You can be doing something else that is more cognitive in nature, but it's just training different skills and just using different parts of your brain that you're not used to using most of the time, and that can just reactivate some different learning strategies there as well. Interesting.
Yeah, I mean, I'm just thinking of a similar concept of, when you're working with someone who, let's say they're struggling with depression, it's the neurochemistry, the neuropsych there that's going on is there's this, there is a pattern in the brain that they're building these trenches in the brain that, when they have a certain stimulus or experience, it goes towards that negative thought process. And part of even, from psychiatry, I'm not a psychiatrist, I don't prescribe, but part of the impact of medication is to stop that trench of thought and then allow people to access other areas of the brain to process the same experience, right? So have a different feeling, have a different thought, and therefore have a different behavior or outcome. But I wonder if that's kind of a similar concept. As you're exercising different areas of the brain, it allows you to, activate a better tool of, being more resilient or having, right, some a bit more, you're a bit more well than usual.
Exactly, yeah. And even just sort of improved focus and attention. If you're used to, maybe you're just going through your day and maybe your work isn't particularly challenging, or it's challenging in a very repetitive and monotonous way. by doing something that involves a new learning element, you're having to focus, and you're having to pay attention to the learning aspect of that. And by doing that, you're improving your ability to focus and improving your attention span. And I think that can be really beneficial as well. In terms of, some of the other challenges to implementation of exercise, we talked before about, how improving sleep quality can start to break that loop of, not having the energy to exercise. What other sort of strategies? So if someone is very exhausted and they just don't have, whether it's sleep related or whether it's just the overall stress of the stress that they're dealing with in their life, and the stress associated with their condition. For me, I think going back to trying to identify the types of exercises that are likely to, or the type of environments, whether it's with a group, whether it's one-on-one, whether it's a new skill, whether it's just spending more time outdoors, things that will just be more likely to energize that individual. But also trying to work a little bit with time management and find the times where the person is most energized. That might be the morning. For some people, it might not be the morning at all. They might just find that they're completely useless in the morning. I have the luxury of, I start work very early in the morning, but I usually have a downtime during the middle of the day when I can get to exercise. And for me, that is what works best. But I think, trying to identify some of those patterns within the person about, when they function best, when their energy levels are highest, and when we can sort of, capitalize on those high energy levels, even sort of within the week. If they feel like they're very sluggish, at the start of the week, maybe, trying to put the exercise in towards the latter half of the week as they start to feel like they're a little more energized. And maybe you sort of find the same thing with some of the other interventions that you implement as well.
Right. Yeah, I think it's hard to kind of know where to start there, right? But I think if you you work with the individual, you try to break down, what are their pain points, where are they really struggling, and assess again their values and their goals. What do they want to get out of either the counseling session, or if they are trying to get exercise back into their routine. I think you have to lean on their strengths and find a realistic time frame or framework, right? So if it's the morning for someone, you want to check out, make sure sleep's in order. But like, let's say they enjoy running, they don't want to go to a gym. All right, well, you set up a routine or regimen of, okay, well, let's start slow. Let's do once a week, right? Or let's do once every 2 weeks. And then you have them set out all their gear before they go for a run, right? So get the shirt, get the shorts, get the whole workout gear ready, have your shoes set and ready, where all you have to do is step out of the house. And, ideally, maybe they want to go for a 30-minute run, but set the bar low and just say, let's aim for 20, or even go a little bit lower than that. Let's go for 10 or 5 minutes, right? Just get out the door, and then you can go right back in and go to bed. But if you get that far, you're probably gonna go the full extent. And I think the challenge, though, is after you get them through that first layer, right, and maybe let's say they wake up, they go work out, maybe sticking to that and building a routine is difficult. So that's kind of where you go back to assessing someone's values and helping to remind them of their values and what's core and important to them. And again, also, I think when people go at it alone, it's really, really difficult to keep yourself accountable. So either I am that kind of, stable person that I'm going to be there once a week. They're going to come see me. They know they're going to be accountable. They've got to report on this. Maybe that's their motivation, or it is kind of getting themselves in a gym and trying to have a trainer or some other forms of accountability there. So.
Yeah. Are there any other sort of challenges that you've come across in trying to implement exercise into someone's mental health management program?
Right. Yeah, I think, to be quite honest, when I work with individuals, often they're just in such a difficult, challenging place that, maybe it's exercise is one of a list of things that they're struggling with. So, I try to narrow down, okay, well, what's the most crucial, most important issue that you're dealing with? And, we usually find that once you tackle that most critical issue, right? So like maybe, hey, I'm going through a divorce, My wife left, and I'm just trying to get through that. I'm trying to wake up every morning, trying to function at my job, right? You've got to kind of focus on those bigger issues before you can even get to the exercise. But I find that once people work through that initial problem, that usually there's a bit of a ripple effect that happens for all the other problems in their life. So let's say they had a good, healthy routine, it's almost, in certain circumstances, it's like clockwork that will just come back on board. And so, you simply just discuss it. And by making it a verbal discussion, bringing things out into a dialogue sometimes just is all that's needed to get people, okay, yeah, back on board. This is important to me. I'm going to do this. And then you have habits from a clinical perspective of just checking in with the person from time to time on how they're going. And then they come back and they say, yeah, I'm off track again. Okay, well, you go back and say, at what point did you get off track? What happened? What was going on around that time? And then can we address that? Can we talk about that so that we might help you get back to a place where you're ready to take on that challenge or that task again? And the challenge is just simply, getting to the gym or getting out to exercise, because again, once people are in distress, they will often forsake their physical health as a way of trying to combat all these other stressors. So I find that, again, to summarize, tackling these other stressors sometimes is what's needed to free them up to get the exercise that they need, or to start prioritizing their physical health.
Sure. Okay. Some fantastic information there, and really enjoyed that discussion. I think there's some great points in there that's really practical stuff that people can take away. Any sort of other last messages for people who feel like an exercise will be beneficial for them, and any sort of general advice on sort of getting started?
Yeah, I can't be a hypocrite here, right? I mean, physical exercise is a struggle for me. I'm no expert in that area, right? And so I would just say, you're not alone.
Yeah.
And that, if you are to take that risk and have a personal trainer or join a gym or join some kind of a running group or something, right, that actually takes a great amount of courage, right? It takes someone who is courageous to do that, right? And so, you're not signing up for failure. You're actually showing the strengths that you have to be able to jump in and start prioritizing your physical health. And that's the message for myself here, right?
Yeah.
Which I'd love to share my journey sometime, especially over the last couple of years, the things I've struggled with, the things that I've felt successes with. But my message is this, that, you're not alone. And this is something we're all experiencing, dealing with, especially in the pandemic. And my advice is, don't go at it alone. Get in a community, connect with someone. There's a lot of groups and clubs out there, and it's just a mental reminder to prioritize it, right? It's our physical health is everything, just as much as our mental health. So
yeah. That's great. And I think that's really sort of been the message so far with all the people that I've spoken to. And this is that, don't go at it alone. We're sort of all in this together. And there's always help, and there's always support with whatever aspect of life that you're dealing with challenges with. So,
And I would say join our Tokyo Tower climb, right? There's going to be community people getting together on Saturday for corporate, Sunday for the community. So sign up for whichever is appropriate for you and come join us. Not sure if this is going to air prior to that, but we're also doing the Step Up, which you can do on your own or in a group of people. And so, please check that out as well.
Yeah, I was actually going to close with that. This will air in a couple of days, so it'll be before the event. I know Club 360 have got a team ready to go on Sunday, so we're really looking forward to that. And we're actually Club 360 will be providing 2 massage therapists to provide some free massages for those involved. So if you want to get out and participate and also enjoy a quick free massage, then come along. Is that still open for applications at the moment? Do you know?
Yes, yes,
Okay.
it's still open. You can sign up, you can register. And Sam, big thanks to you and your team. Thanks for putting together a group of people offering the free massages. That's incredible. Really appreciate that.
No, we're looking forward to it. Should be great. Well, I've thoroughly enjoyed this chat, Billy. It's been great to have you on, and yeah, I've learned a lot from the discussion, and yeah, I'd love to have you on sometime in the future and talk a little bit more about this stuff.
Yeah, me too. This was a lot of fun. Thanks so much for having me, Sam. Appreciate it.
Cheers, Billy. We'll see you Sunday.
Okay. All right. Take care.
Take care. Bye.
All right. Bye-bye.